I want pyramid scheme. I want to have a pyramid scheme.
Pyramid scheme for good.
Welcome to In Moderation,
the show where we give you a moderate dose of info, sarcasm, and we already know we're not approved. Hey everybody, welcome to episode, I know, 69 minus 1.
Yes, you got it.
Oh, yeah, sorry, episode, that's what, sorry Taylor, we're doing 69 minus and then plus. Like, you know how it's like, we set BC, 2000 BC, like that's basically ours is 69 because we're very highbrow and we like humor, but we want humor that's like, like people sit around in armchairs and sip their whiskey and laugh at, not like that, basic humor. You know what I'm saying?
Yeah, of course.
Good. Okay. Well, yeah, I mean, we'll just jump right into it. Taylor, why don't you tell us a little bit about yourself? Because I feel like in the last few weeks, Rob, we've kind of shot the shit for 20 minutes and then we're like, oh, we should probably introduce the guest or something like that. We spent a lot of time, probably more time than we should. So how about we cut that back dramatically and just let you introduce yourself here.
I'm Taylor Nichols. I'm an emergency medicine and addiction medicine physician. I live in Sacramento, California. I work in a low barrier harm reduction based clinic in Sacramento. And I also work sort of across the continuum of care for people who use drugs, including for patients who are hospitalized on an inpatient consult service and in residential treatment as well.
Okay. Now, I'm very curious because you say harm reduction.
Yes.
Okay, so to me, that means there should be less harm. And that's about as far as I get.
Hitting somebody slightly less with the baseball bat.
So there's harm and then you take less of that. And that's harm reduction. That's pretty much all I know. Can you tell me what actually that might mean?
That's a great question. So harm reduction, the premise, the sort of basis, the original definition of harm reduction, it is born of people who use drugs, created by people who use drugs for people who use drugs. Uh-huh. And the idea is simply any positive step towards whatever that goal may be. So I like to use the term recovery from the context of the verb to recover. People who are in active use may have negative consequences of their addiction or their substance use disorder. And from their use, they've lost things, for example. And so to recover those things is their recovery process. I don't think of recovery as abstinence only. Recovery can be whatever people want it to be. And so any positive step towards that goal to reduce the harm that their use is causing to themselves or their community is harm reduction. So it doesn't have to be abstinence. It can be simply drinking less. You can be taking one beer away a day that somebody's drinking. That is harm reduction. And it is supporting them in those goals, in being able to accomplish those positive steps that are helpful to them and decreasing the harm to them and to their community. So it's really, it's any positive change.
I imagine that, going cold turkey could be actually more harmful for some people.
Yeah, absolutely. And some people don't want that as their goal. And my goal in working with them as a patient in clinic is just to define what their goals are and then help them accomplish them. And if it is to remain abstinent from a particular drug forever, fine, I will support them in that. I'll help them find the recovery spaces that are abstinence only focused and help them achieve those goals. But say they come to me and they have a few different substances that they're using. Say they want to completely stop using opioids, but they also drink and they don't want to completely give that up yet. I'll approach that person and say, hey, we have a medication like buprenorphine that we can use to help you manage both the withdrawals and then the cravings. That can help you remain abstinent from opioids. However, we don't have to say just stop drinking or manage to wean you down off of that. We can say, all right, how much are you drinking now? 12 beers a day on top of using fentanyl, say. We'll get you off the fentanyl, then we'll work on the alcohol. And then when we work on the alcohol, we'll say, instead of drinking a 12-pack, try bringing that down a little bit. See if you can get yourself down. What's your goal? Oh, you want to get to a 6-pack a day? All right, let's split the difference and work on that for now. You got there? Okay, then let's keep going down to a 6-pack. And then when you get to a 6-pack, how do you feel? What are the harms that you're feeling to yourself, or you still feel that there are harms to your community surrounding your use? And if you're not to where your recovery goal is, and you say, no, I still think I should cut back more, then we'll work on that. But that's the idea, is to sort of, you can create those positive changes through small steps and focusing on what is causing harm and how do we reduce that.
Yeah, it seems like kind of better, but not necessarily perfect, right? Like we're just trying to focus on better.
Yeah, right. Perfect is the enemy of good, right? We want good. And perfect is sort of like an artificial definition, because abstinence is not everybody's goal. Right. Perfect might not be abstinence to a person. To society, society might say abstinence is the only option.
Right.
In which case you're following a social definition of perfection, but that may not apply to an individual.
And that's kind of like, I like that just because, we do that just more on the basis of nutrition. Like, hey, someone's drinking, I don't know, like 6 sodas a day, instead of like, hey, maybe like 5, 4. Like, I feel like with drugs, it's a little bit more, it's a little different, maybe a little bit more extreme, maybe more important, but like, still we kind of try and do something similar.
That's spot on. It speaks to the fact that we treat drugs differently than other things, right? We can look at somebody from a nutritional standpoint and say, hey, why don't we use a harm reduction based approach? And that's okay. But when you talk about harm reduction in the context of drugs, people are like, oh, well, they just have to quit. And you're like, well, that's not consistent with harm reduction. That's not really how we do things.
I think the only like harm reduction like policy that I have seen and discussed and that I always thought was interesting, and maybe you can speak to it a little bit, is kind of I don't know how their term is, like the needles. Basically, like safe injection, but they also hand out like needles, like clean
syringe
needles,
exchange.
Basically. Syringe, okay, let's go syringes. Let's go with that. And so because on the one side they'll say like, oh, you're giving people syringes. Basically, you're saying yes, it's okay to do drugs by giving them these needles. Is what the opposing side, I guess, would say to those policies.
And I would respond to that by saying, you're taking a community of people who are using drugs. You aren't going to immediately change that. And you are reducing the risk of harm of bloodborne diseases within that community. And so this actually speaks to the origins of harm reduction. So it's very intrinsically linked to HIV and AIDS, and the rise of HIV and AIDS as an epidemic or pandemic sort of globally, where people recognize that people who use drugs, people who injected drugs, were going to be at very high risk of HIV as a bloodborne disease. And so practicing syringe and needle exchange, and I use that term in the context of like giving people needles. I will just want to be careful about that, because syringe exchange, some people say that has to be a 1-to-1 direct exchange, and that can be harmful because not everybody is coming in with a needle to give. Like, somebody who, it's okay to just give people clean syringes and clean needles, regardless of if they have a prior used syringe or needle. That may not be the way, they may not have them, the ones that they had used. And it's okay just to support safe use, and so that they are also not giving their needles to other people. Say they want more than they have on hand for themselves. They want to be able to give them to other people because they're using with somebody else, rather than giving them one so that they can then share it with somebody else. That would defeat the point. And what we've seen with those is that it did directly impact and reduce the spread of bloodborne diseases like HIV and hepatitis C. So and we also know that when we take those things away, when people who are whose beliefs are sort of antithetical to that come into power and they take away funding for those programs, we see an increase in the transmission of bloodborne diseases. right? And so the idea that you can just somehow make people who use drugs stop using them
Right.
is fantasy. That's not how humans
That
work.
basically what seemed to be like the war on drugs was, right? So like war on drugs, are you all for it or just mostly for it? Like which one do you?
Well, and I like to say drugs will always win the war on drugs. Every time you make more prohibition-based policies, you're going to lose. But drugs will always win because that's part of human nature. People will seek to alter their consciousness, regardless of whatever policies we create. And so we should create policies that wrap around that reality and allow people to try to reduce the harm to themselves and society in the course of using drugs. And that's okay. Like, we can't just simply say nobody should ever use drugs ever and just like cover our eyes and our ears and pretend like it never happens, which is what we try to do more often than not, unfortunately.
Yeah, and then you end up with a lot of people in prison for drugs.
I feel like this syringe exchange probably acts as a foot in the door as well, since people aren't likely to go get help because they want to quit drugs, but they might go get help to get these clean syringes, and then they get introduced to things. And
that's absolutely. If people want to pursue any form of recovery, right? If they want to reduce their use, if they want to quit using, they want to find the resources to do that, having places that are recognized as safe to those people, to those communities, are critically important. And so being able to approach them and say, hey, yeah, come into this harm reduction center, this harm reduction-based clinic, this overdose prevention site, and where you can get clean needles, you can get clean syringes, you can use, ideally, right, if we allowed overdose prevention sites, which are places where people can go use their drugs in whatever form they use safely and without the chance of law enforcement presence, without the chance, in a non-stigmatizing way, where people can come in, they can use drugs, and then they can leave. But that's also a place to access them. That's a place to reach them for healthcare. It's a place to check in on them. But it's also a place where they have a quote unquote responsible person in charge who is at that time not under the influence of anything and can administer Narcan, for example, to reverse an overdose. And so millions of uses of drugs in overdose prevention sites, 0 overdose deaths. If we really wanted to reach people where they are and provide them healthcare and provide them resources and access to be able to seek recovery in whatever version they want,
right?
Overdose prevention sites are a perfect example of that. Needle exchanges, harm reduction programs are examples of having that access in a place that is trusted by the community of people who use drugs, where they're not going to be stigmatized. Because I'll tell you what, I'm also an ER doc. I know that a bunch of my patients in clinic don't want to go to the hospital because they know that they'll be stigmatized. And as an ER doc, when I see that and I see how people are fearful of seeking care and they feel mistreated, they're not going to come in. They're not going to get care when they need it. And it's going to lead people to die from simply not accessing care, right? And so in that way, we say that stigma kills, because the stigma that is within healthcare among even my colleagues, right? Something that I fight amongst my colleagues is that seeing them stigmatize patients who use drugs. I have had people who have come in and they say, I know I'm a junkie. I know you probably just think I'm here to get drugs, but I really need help. And I will pause and I'll say, a little bit of like gentle redirection here, but like, I don't think of anyone as a junkie. And for fact, I prefer to not use that term at all. And I prefer you didn't call yourself that. You can identify yourself however you want. But I've had people like break down and cry to me over the fact that simply it's like, wait, you don't care about that. You don't want to treat me as less than. And it's like, yeah, you're here for me to provide you care. You don't have to humble yourself before me. The opposite should be true. Like, you're
But I'm
here
sure that's
seeking
not
my
always their
care.
experience with
No,
other doctors.
most
Yeah.
of the time, I'm sure it's not. And that's the stigma from doctors, from nurses, from other affiliated health professionals, right? And so fighting that within society, within healthcare, is critically important to making sure that, Rob, just like you said, that people will access the care. Because if you can give them a trusted place to go, they'll go there. And then you can reach them and you can have those conversations of like, hey, how do you feel about your use? Is it causing you harm? Is it causing your family harm? How are your relationships? Like, we can make that better. We can try to find an approach that will decrease that harm. And I guarantee you, people will appreciate that approach more than just shunning them or stigmatizing them or telling them that they should just, stop using drugs. Like, that's not gonna work.
So what are
So
the, I'm kind of curious, like what the
yeah.
challenges are, because you were talking about these places people can go and feel safe. Like, what are the challenges to creating more of those places? Is it the stigma? Is it policy? Is it the war on drugs? Is it a little bit of everything? Like, what's, what are the
Oh,
challenges there?
Liam, you nailed it though. All of those things. Like, those places are stigmatized. It is. So I've had discussions with people, with policymakers about overdose prevention sites, and that's just a political landmine that a lot of people don't want to jump on. It actually, so I'm in California. I work with the California legislature in advocacy efforts, and because I can walk to the Capitol from my house. The California Assembly and Senate passed a bill to legalize the creation of overdose prevention sites. Both bodies passed that, right? So bicameral state legislature had to get to the governor's desk. The governor, Gavin Newsom, decided that was not politically viable solution, was too much of a political landmine, and vetoed it. So that is not legal in California. It would be great if that passed. If they open one, I would volunteer to be a medical director at one, because I think it's that critically important. So that's one step. Like, from the top, it's not even legal, right? Despite the fact that bars are safe consumption sites for alcohol. We have collectively decided as a society that alcohol as a drug is different than other drugs. And
That's always been very interesting to me, that we just kind of like, I mean, we did try and ban it for a little while, like 100 years ago, and it went real kind of poorly. And then we're like, okay, no, it's fine. So like, I've always found that very interesting. We're like, yeah, all right, well, we just let it go. It is what it is.
And then we don't want people drinking in public. So what do? We allow them to drink in bars. And so if we don't want people using drugs in public, which is like right now the big hot topic, what do we do about the people using drugs in public? Right. Okay, well, do what we did with alcohol and allow them to have a space to not use drugs in public. Like, there are easy answers to this that history has already provided us. We just need to understand that history. And so that is one factor, would be on a policy level. Say that policy passes. Where are you going to open it? Well, stigma is going to prevent you from being able to open it, being able to operate. They already exist in Vancouver, in New York, and Rhode Island is opening one, or just opened one. It is possible, but you have to get people on board with the idea that there's going to be an overdose prevention site in their neighborhood, right? And so stigma is going to be the problem that you'd face there on a local political level.
I bet you get people like protesting and like with the little signs and everything outside one of those, like, they're doing drugs here. We're allowing this.
We're allowing people to use safely and responsibly in a way where they don't die. Or they could just
as opposed to just shooting up in their backyard.
Right. Or in isolation, or, some of it's public, some of it's not public. Some of these people are housed and don't have to use in public, but they would rather not use in isolation. They would rather not use alone. They'd rather go to a setting where they can have a responsible person in charge who, just in case, can check on them, right? These are all reasons that would be helpful to take people both out of isolation and out of the public and bring it into a safe space.
I think that one of the biggest challenges that this is just going to face is not to be callous, but I think we kind of have to just like talk about it. People like, oh, they're a druggie. I don't care about them. Like, it's the same thing with like prisoners. Like, whenever there's a bill that like tries to, reduce cruel and unusual punishment in prisons, I've always seen like, oh, fuck it. No, they're prisoners. They put themselves there. Who gives a shit about them? And now you've got people using drugs, which to them now it's a criminal act. So, they're also sort of a criminal and using drugs. It's kind of this combination for people that are like, I just really don't care about this person, whatever. So like, I feel like getting people to understand that like, hey, this is, a human being. It could be anyone. It could be someone you talk to. They're struggling. This is addiction. We need to treat it, medically. That's going to be tough.
On a systems level, stigma works to other people. And once you can other somebody, it's easier to then say, oh, well, you can, California had a proposition just this year to eliminate slavery from our state constitution. Because if you are imprisoned, you can be forced to work without pay.
Right.
But literally that was like under slavery, that was sort of the idea is like, oh, we're not going to allow chattel slavery. We're going to allow people who are prisoners to work for free. That was like the end around for slavery.
Yeah. And then we just arrested a bunch of people for whatever reason. And now we have a bunch of slaves basically.
And so people in California were trying to eliminate that from within our state constitution. That got voted down. People are okay once someone is othered enough with saying you can treat them poorly. It's not me. I'm not a criminal. I'm not going to jail. I'm not going to have to face this. And yes, you can treat them, that other person, badly. And so stigma is really an effective tool for doing that. Same thing is true with people who use drugs, right? Just like you said, Liam, like that's spot on is people are already saying, well, that's a criminal act. You shouldn't be allowed to do that, which like that already becomes a problem because that's based on the war on drugs. And then also we don't like people who use drugs and therefore you're a criminal and you're a person who used drugs. We can treat you poorly and we don't really care if you live. Like the idea that an overdose prevention site with 0 deaths is not a good idea is telling me that you don't care then that people who use drugs stay alive. Right? Like if I pitch that to a person and I give them data and they're like, yeah, but we had, it's like, how many fentanyl related deaths did you have in San Francisco just this past month? Over 40. That's less than it was a few months ago where it was like in the 70s to 80s. It's coming down. That's still more of a large number than it should be. And it could be 0. And so if I propose a solution that offers 0 deaths and you're like, no, we don't want to do that. What that says is your values don't align with saving the lives of people who use drugs, right?
I remember one politician, I don't remember which state it was, but basically their policy was like, hey, we should allow people to get 2 doses of Narcan. And then after that, you don't give them another one. Or maybe it was 3 and you don't get 4. I don't remember the exact number. Like, I just remember, and I was like, this is just a really kind of wild idea where you have like paramedics show up and they kind of pull out a list and they look and they're like, oh, I'm sorry, Terry. You've received 2 of them. We're just going to have to sit here and watch you die because we can't give you a 3rd one. And people there was people that were like, yes, totally. Like 3 strikes and you're out or whatever. Just like, and I'm like, is that the solution? It's like, and it seems like to a lot of people, the solution is just let them die. Like if we're being honest here, like
it is.
And I don't feel like that's going to do what they think it's going to do.
Well, there's so many layers to that. And it's true if you look at so many other facets of the conversations we have around healthcare, right? The ideas about repealing the Affordable Care Act, the idea that, well, we don't just let people die, there's the emergency department. Well, like, that's not primary care, and like people should know that. And also, not everybody makes it to the emergency department for the like massive heart attack that they have.
And they seem to care about price and money and costs. Like that's way more costly than the alternatives.
Right. And so those conversations are old, tired conversations that are had over and over and over again. in different ways about different topics based around the idea that we can other people. Oh, you can't afford healthcare, or it's all around in people's minds who and what is deserving enough. And the problem comes when people can say that other person is not deserving enough, regardless of their humanity. I think, and it's always about, punishing the other people. So like, undocumented immigrants, they shouldn't get healthcare. And you're like, well, why? And they're like, people will say, well, they don't deserve it. They haven't paid enough taxes to earn it. I am, as an ER doc, when I work in the emergency department, I have a mandate to provide care to anyone, regardless of their ability to pay. And again, Liam, like you mentioned, that is the most expensive way to provide care. So,
yeah, no kidding.
So you can't say that we truly don't believe people deserve care, because we've decided as a society that everyone who comes through the door in the emergency department has to be provided care. Like, we passed the law. That's what EMTALA says. The
Well, we'll see what the next 4 years brings, because like, I don't know, that seems like something that could that some people would be like, well, let's just get rid of that then. It's problem solved.
I mean,
like the safety net.
That is that you're right though. That is the legal safety net that mandates that emergency medicine physicians provide care to everyone who comes through the door. If you got rid of that, that would be a problem. Are
some hospitals, are they all required, or is it like private? Some hospitals don't have to. Like, I was always curious about that.
Yeah, if you have an emergency department.
Okay.
So if, like, say you aren't an emergency department, say you're in urgent care, you do not face EMTALA.
Okay.
So under EMTALA, any emergency department, or frankly, because it's the Emergency Medicine Treatment and Active Labor Act. So anyone in active labor. So if you have an OBGYN department, if you have a labor and delivery unit in your hospital, they're also beholden to EMTALA for labor and delivery. Even if they say like didn't have an emergency department, it's just a obstetric hospital, like they're beholden to EMTALA standards because of the active labor part of the emergency medicine and active labor. And so, I mean, it's the same idea with harm reduction principles, right? We can reach everyone. We can save their lives. We have the tools to do it. We have to have both the political will and
that's a big hurdle, I guess. It just feels.
And then it's a huge hurdle. I mean, that's realistically the biggest hurdle. And then the practical implementation of those tools is also difficult, right? On a local level, you have to like find the place that allows you to do that, and you have to reach the people you need to reach. And so it's sort of twofold. Two factors to achieve to be able to accomplish those goals, but we can get there. We just need people to believe in it.
How do we get there? Like, what you've been doing this for a while. Do you see anything that works better more often, just like kind of on the person level? Like, we're talking to people right now, like I'm kind of wondering what can we do? Like, like vote, sure, like I get that, but like, is there anything that we can do individually?
It's a really good and tough question. And frankly, it requires a lot of people to do a lot of self-reflection, because we can accomplish these hard political things if there's the people power and the individual will to do them, right? Politicians are beholden to their constituents. If enough constituents are clamoring for something, then that politician may change their mind. But that requires a lot of people to do a lot of critical self-examination, right? I did not start so going to medical school, I was not a believer in harm reduction. I didn't start from that place. I grew up as a person with a father who has alcohol use disorder. I grew up understanding the AA abstinence only sort of mantra, and they're sort of the pseudoscience that guides that, like the threefold model of disease, all of those things. And so in my mind was like, oh, well, abstinence is the only answer and harm reduction isn't helping anyone. and you're not really saving lives. And then I finished medical school. I started my emergency medicine residency at UCSF and San Francisco General, where plenty of people were using drugs and seeking care at the only county hospital in San Francisco, which is San Francisco General. And I had to face it head on and say, oh, okay, I get it more now. Now I recognize that I am part of a system that is causing harm to people because they're using drugs. And I was recognizing that people were coming in fearful of being stigmatized, of being looked down upon, of being treated poorly, and that they were more often than not. And when you are faced with that reality, when you accept that you are part of a system that is causing harm, the only logical answer to that is to seek to reduce that harm. And so I had to fundamentally confront what I believed, and seeing and trying to understand how and why people were using drugs and what that really looked like in a practical way, like on the street, helped me to understand that like I needed to change my perspective, not them. And so that's how I got to this place. And then I practiced emergency medicine. I finished residency. I practiced emergency medicine full-time for years, and then saw more and more of the same, saw this as a systemic problem in multiple places where we were taking the wrong approach to this. And at that point, I was like, there's got to be a better way to do this upstream from the problem. Like the emergency department, I wasn't solving people's substance use from there, right? So then it was like, this is a larger scale problem that I need to now go upstream and do that work outside of the hospital and try to encourage people to, one, change their own perspective within healthcare, which I do when I'm, working and when I speak to other hospital systems and that sort of thing. And then the other part is like getting people into treatment and trying to change their own perspective, because there is so much self-stigma and there's so much shame within recovery communities, and trying to get people to critically examine from even within recovery spaces, within addiction medicine, within, people who are in AA, and not demonize AA, but to say, hey, we can reflect a little bit more on like where we're at and how we can help people who are using drugs, alcohol or other drugs. I like to just say drugs because alcohol is a drug, but people are using all of them, right? And so if I can change my perspective, if other people can change their perspectives, we could get to a place where we can advocate more broadly, form that like coalition of people who want to see this change, then you will make that happen. You can get to the point where, like, we got to the point where the bill passed both the state legislature, or passed through both houses of the state legislature, the Assembly and the Senate. Enough people voted for it, right? There's some political will there. But then you need a coalition of people who will go to Governor Newsom and say, you better not veto this time. Like, if he believes that it is more politically viable for him to sign that bill than to veto it, he will sign it. He knows from like doing the political calculus that that's not going to play throughout the entire state, right? And so if you get enough people to advocate, then
we have a solution. Then what you're saying is we just need more people to spend years of their time addressing the problem directly and seeing the flaws in the system that we currently have in order to understand how other maybe things that they didn't believe before might actually be the answer.
Or maybe we just need to have more people go through emergency residency.
Yeah, totally. It's a very, very easy solution. No, I mean, on a practical level, though, if we can get people to just understand, right?
Right.
If there's inertia in change. If I can change and I can change other people's minds, right? The downstream effect. Right? Say, Liam, I change your mind. And Rob, I change your mind. There's two. And then if you both change two people's minds by actually
we need an MLM. We need an MLM, but we need a pyramid scheme. We gotta get a pyramid scheme of change people's minds. Maybe we shouldn't market it as that, but like that's good behind the scenes. That's what we're doing.
I mean, on a certain level, there's a reason those are effective, right?
Right.
Because you're magnifying change rapidly. That is a model of change, just in a very sort of manipulative way, which isn't the goal, right? We're not trying to manipulate people, but we are trying to change people's minds. And if you can change enough people's minds, then yeah, that is sort of the answer right there, though. Like that, if you can spread that message and you can change enough minds, then you can achieve that. And not everybody's going to go through the same process or go about it the same way. But people will get there. It just, some people it may take time. Some people it may take more like direct experience where they're confronted with it. That's how like deeply sort of entrenched my own bias was, that it took years of being exposed to reverse that. I don't believe that's true for everybody. And I think we as a society are starting to do better at bringing people to at least a different starting point than where I was at, I hope. And we can change minds. Now, that isn't the only option. Like an MLM isn't the only option.
What do you mean an MLM isn't the only option?
It's not the only option. It's just the best option.
Told we need to make a pyramid scheme, and I was all in.
I mean, Liam, if you want to talk about creating one, I'm all ears. I'm sure there's a model there.
I mean, like you said, it works. It works, doesn't it? Like, and so you harness something that's usually used for evil for good. And that's,
use your powers for good.
Exactly.
Use your powers for good. That's
can
the
we
answer.
Say pyramid scheme for good? Like,
yeah, sure.
I think we need to put it like at forefront.
Maybe we just need to replace the scheme. Like pyramid's something else.
No, I
scheme
say
is kind of evil.
The scheme. No, but people want to be part of a scheme. Like I think people like being part of a scheme. Like people want to be like on the end of something. You know what I'm saying? Like, wait, what is this scheme? Why would I want to be part of that? Okay, here's what we're doing. Actually, that sounds pretty cool. I'm just saying, like, listen, we do social media, right? I know, like short form social media, like the first 3 seconds are the most important of anything, right? You just got to hook people in. All right. So like pyramid scheme, that hooks people in right away. And then we start talking about like how we're actually trying to help people who are dealing with addiction.
You can call it pyramid scheme for good. Like that could just be the name.
Yeah. Like
social media messaging.
FG, like pyramid scheme for good. Like, I don't know. we'll acromanize it. I was just saying it's maybe not the best option, but it's an option. That's all I'm saying. I mean, the whole thing with like, I will say like the whole thing with like drugs, I've always found it really interesting, especially like looking at other countries and like the completely different ways they'll go about it. Like, I don't know all the ins and outs of everything. Like, I know just enough to be dangerous, all this stuff. But like, you look at one place like the Philippines, which is like basically just anyone who's seen a drug is murdered. Like they have the harshest laws of like anything, right? Like I'm sure you've probably seen some of this stuff, right? Like on the flip side, you have Portugal, who I was just gonna say, like actually Portugal, and I've seen like Switzerland even have done like not made drugs legal, but they've decriminalized drugs, right? And so they've made it so like it's easier to seek treatment. It's more it's seen more right as like as a medical issue, right? So that needs to be treated than it is a crime that we have to lock you in prison for many years for. Correct? In Portugal, so Portugal put their entire sort of money and effort behind this idea that decriminalization could work in hand with Rob, like you mentioned, the idea of improving access to treatment. And that if people come and you give them a safe space, they may want to pursue treatment, and you need to have the availability there. And so I know when I talk about Portugal and that they dramatically, right, they spent about 20 years doing this, I think. Now they've cut overdose deaths down to essentially like negligible compared to our over 100,000 for a couple of years. The people will potentially point to Oregon, and Oregon decriminalized small dose possession of all drugs for a brief period over the last couple of years, but they didn't put the money and the sort of enforcement ability to create all the treatment spaces and the bed availability and all that.
to low barrier treatment.
Which is kind of a necessary.
That's the key part. And so they people will say it failed because they repealed it after a couple years, 2 or 3, because they were like, oh, there's public drug use has gotten way up, and now the police say they can't do anything about it. Blah blah blah. Well, if people can't access treatment, then like, what good are you doing if you are just like, oh yeah, sure, anybody can use drugs anywhere and it's legal? Well, it's decriminalized, so it's not illegal. We're not going to necessarily take them to jail for it. But you can't help. Then what are you doing, right? So the difference between Portugal and Oregon was that Portugal like invested heavily in this idea, and it worked. And if you don't invest heavily, and that may be part of the political will problem, is people want to take that half measure. They want to say, well, it's decriminalized at least, but they don't put any money into it, then that's
because we see these people as criminals already. So, it's basically like, hey, let's spend a bunch of money to help people that you've already othered.
Yeah.
That's a hard sell. That's like, selling whatever. I don't know, one of those analogies. You're selling the sand to someone in a desert, whatever. I don't do analogies. I don't know. But like, I don't feel like it's not going to go super well, right? Yeah. Like that's hard.
That's hard. And that is part of the political problem, is you have to be able to overcome that. And that is as a much more complex sort of political answer than just like, hey, we need to help decrease stigma towards people who use drugs and help support the, political will towards allowing things like overdose prevention sites. We could do that. And that could still work without sort of decriminalizing everything and then requiring treatment beds and all that. That would be sort of another layer to that piece of the puzzle. But I think we can get there. We just have to start somewhere, right?
I was just going to say, like, I think the way, maybe one of the ways to try besides a pyramid scheme is to try and tell people that, like, the situation we have now is like, it's not good. Like our system is literally set up to cost basically the most amount of money, where people have to go to the emergency room, and that's incredibly expensive. And we're constantly talking about how much we spend on, medicine in general, right? Like, because we spend like a crazy amount. This isn't the only reason, but it's just not helping. So like, I feel like maybe one of the best ways to go about it is just like, hey, this is what we have right now, and it's terrible. So like, would you be willing to try something else that would maybe also save money? Because you like that sound, probably.
Yeah. I mean, and that's the thing. They will save money. And they like, you can save money, you can save lives, and you can take people away from using in public. Like that, it seems like a win-win-win.
Yet then you have to say doing drugs is okay. And I feel like that's the one that is like, for some people, there's like, the war on drugs has gotten too deep into their skull. Where it's just like, just say no, like Reagan said, and then it's not a problem.
Well, another thing we need to do is rehumanize these people that are using, and like, that's not going to work for the people who are far right and they only care about the money. But I mean, like,
we
was mentioned earlier.
Money, we get them with the money. Like, just those people, we just focus on the money. But everybody else, we try and humanize.
There we go. It was mentioned earlier that these people, a lot of them are probably going through stressful times and stuff. And the more you beat them down, the more that they are going to withdraw from society and rely on drugs to get by.
I have used the term, people use drugs to save their life, right? Like, ask a person who uses drugs why they use drugs, and you will hear many people say drugs saved my life for a variety of reasons. But if you are in a situation that is deeply uncomfortable, traumatic, stressful, what have you, just like you said, Rob, like, people are going to use drugs as a means of escape, as a means of finding some level of, whether it's tuning out or finding some level of joy, whatever it might be, that like saves their life, that prevents them from dying or dying by suicide or whatever it may be. When you have people say drugs saved my life, like, it's hard to look away from that and say, but we should never allow people to use them.
I find it interesting you say, I used to say, like you said, die by suicide. I feel like it's a change that I actually do like. I try and say, instead of saying committed suicide, as everybody says, because when you commit something, generally you commit, arson, burglary, a crime. Whereas, like, did you really, you took your own life? We criminalize even the act of taking your own life. That seems real rough. Like, so you die by suicide. So I think it is a nice thing if people can start saying that in the future. But like, still, sometimes I'll catch myself saying it because it's just so ingrained in us,
Yeah, absolutely. And it speaks to the whole point about humanizing, right? You're just like trying to humanize people's lived experiences of whatever they are experiencing. And sometimes it's, deeply difficult. And it's okay that we reconcile that with the ability of drugs to create opportunities for people to continue living. And that is okay, right? Like I think we collectively agree that people continuing to live is generally a good positive
for the most part.
I would hope so.
I feel like we can come together on a few things and be like, less people dying. Can we all give a thumbs up? Like, what do we do? How do we feel about this? I think I would hope most people would be on board.
I imagine another potential benefit to these harm reduction sites is just the ability or the potential for people to find others in similar situations and feel less alone.
Yeah, I didn't think about that.
Yeah, absolutely. Like, drug use and substance use disorders in general are surrounded with shame and stigma and internalizing social stigma. And so people often end up in situations where they're using alone, they're using in isolation. They don't understand that there are other people in the same place where they are. And finding that community can be incredibly, not only can be an incredible relief, but is incredibly important to them being able to form a self-identity, to be able to move forward regardless of whether they want to be, become abstinent in their, like recovery process, or if they're just like, oh man, this is getting out of hand and I need somebody to hold me accountable to moderate my use or whatever it may be. That is incredibly helpful. Just community building in general. We are social beings, right?
Yeah.
Like, that's useful for any of us. But that is a specific thing that is like isolating, right? And stigmatized.
What you said though, like, really gets to the heart of the issue. With the drugs are an escapism, like there's the people are dealing with their lives and things are shitty. And, you turn to drugs. It makes sense, right? Like, that's what humans have been doing that since we've had drugs, right? Like, like you said, we've been doing drugs since we've discovered drugs. Like, we find, oh, this frog, if I lick it, things go weird. Then I'm going to keep doing that. Like, it's kind of tough to just be like, don't do that. So, like, I think, just trying to, just overall, just trying to improve people's lives, it's got to be like one of the answers there. And like, you look at any like drug treatment facility, center, rehab, whatever it is, they try and, show the people dealing with addiction, like other things, right? Like, there's just like, hey, what if there's this and that, and there's other reasons. And, that's when you're fighting, heroin, that's gotta be really hard, man. For anybody dealing with addiction, I'm so sorry. Like, that just has to be the absolute fucking terrible. I'm just going off on a tangent here, but it's, just basically, trying to improve people's lives, I feel like, is one of the best things you can do.
Certainly a worthwhile goal, in my opinion.
But then it gets into the like, okay, how do we do that and this and that? Like, that's, when you're looking more for like, what can we do in the, right now? I think, like you said, creating these places people can go that are safe seems to be one of the better things we can do, as opposed to, again, having a terrible system that we have now that it's just awful.
Yeah, it's tough, but I appreciate you guys having me on to talk about this. That is one of the answers, right? Is like trying to spread this idea. It's the MLM, if you will, Liam.
Listen. I like the peer. Why don't we could also call it a cult? It's a cult we're trying to get people into, and then people are very confused and they find out why, and they're happy. Then they're like, yes, less,
For good.
less deaths from
Yeah.
drugs. That's good. I like that. I'm part of this pyramid scheme now. I'm just saying, it's not the worst idea. It's not the worst idea. Oh shit. Well, I mean, also, I guess, like, do you have any? Here we talk a lot about nutrition. Do you have anything to mention about, like, drugs and nutrition here? Any of the combination?
I think nutrition in addiction context is really interesting framing. Speaking of sort of how nutrition relates, there are things that also leverage the same things that cause addiction to drugs that cause addiction to food, right? Like food can be an escape. It can be pleasurable. It drives dopamine release. People can use food in a way that helps them with that escape and release. And so people can develop sort of eating disorders or disordered thinking around food the same way that they develop substance use disorders, disordered use of drugs, right? So it's something to think about and be mindful of as we seek to approach addictions, is like food can be used as an addiction. Food can be addictive in that sense. And so I use that word a little bit cautiously because I don't think like drugs themselves are the addiction forming problem. Like the vast majority of people who use drugs don't develop an addiction. Same thing is true with food. So it's not the like substance itself. It's the way that it's used. It's the context with the, so substance use disorders form in people in sort of like a threefold model, I guess you'd say. Like there are three factors. It would be like we know there's some genetic component that people are more predisposed to develop addictions or substance use disorders. They have to have an environment that creates the necessary circumstances where that drug creates that positive feedback. And then you have to have the exposure. And so even though I am generally on the side of like reducing harm, I'm not on the side of like, let's make everything legal and increase exposure. I'm okay with providing people informed consent and putting warning labels on things and like telling people that smoking can kill them. Like people are like, oh, but what about, like, isn't that part of like harm reduction is like just letting people use drugs? It's like, well, I mean, yes, insofar as we should provide people help where and when they need it, the way they want help. But we know that if the more people delay their exposure to drugs, the less likely they are to develop substance use disorder. So the same thing is true with food, right? Like all of those things from a nutritional standpoint, that matters. We should be thinking about how we label food, how we approach food, how we allow people to be exposed to it. Because I'm sure if you broke it down, and I'm not like an expert on the nutrition side, I'm not like a dietitian, but like I'm sure there are other ways to approach exposure in the same way that we approach exposure to drugs. And yes, I'm all for the ideas of like, if something is found to truly be harmful or have potential negative consequences, we should label that. We should provide warnings for that. We can ban things. I'm okay with all of those things. But to try to reduce people's consumption of harmful things, I think like in Rob, to your point also about community, like there are community support groups for these things, right? Forming community and recognizing that you're not alone in your own like food addiction is also valuable in terms of forming that self-identity and decreasing the self-shame and stigma. All of that is important. And so we can view them sort of through the same lens. Like food is not inherently bad, but it can be used in harmful ways. Drugs are not inherently bad, but they can be used in harmful ways and they can lead people to dying. Just like food can lead people to dying. Like poor nutrition can lead to bad outcomes. Drugs can lead to bad outcomes, and we can recognize those things, but also try to like improve the lives of the people who use them.
In moderation brand, Bobby Reduction Center coming soon to a city near you.
Reduction Center. I think we have to spend our money a little more wisely, but like we'll throw it on the list.
Depends how successful that MLM is.
Yeah. Yeah. And that's the thing, with people with food, you're surrounded by food all the time. Like you need to eat, you need food. So when you have it all around you, you always have that exposure, right, to it, which for a lot of
Yeah.
people can be really difficult.
Yeah, absolutely.
So if we have somebody in our lives that could use going to a harm reduction center or something, what would be a good way to approach that to get them?
That's a great question. So one thing I will say to start is like, I generally think of interventions in the context that like the sort of classical context that we think of as interventions, like sit down and everybody's going to like basically shame this person, tell them how bad they are and they need to seek help, as inherently problematic. Are there ways to do that more ethically? Sure. But I think you can just approach the conversation and say, hey, here's an issue that I see, right? I've seen that you struggled with food. I've seen that you struggled with your heroin use getting out of control. Are you interested in talking about that? And if they're like, yeah, I know I'm really having a problem, then you can say, hey, like, would you be open? I know that there's a place that it's not going to shame you or stigmatize you about your use, but they'll be willing to talk to you about this. They might be better than me at having this conversation about how we can go about helping you in terms of your use so that it's not out of control, so that your life doesn't feel out of control. I think driving, like isolating them more and shaming them more is just going to be more problematic, and they're going to reflexively basically want to tell you to F off and like, I can do it myself or whatever it is, or I don't want to do it your way because like you're making me feel ashamed. You're making
you're
me
an
feel
asshole,
alone.
an asshole.
Yeah.
And so if you can approach it just from like a friendly, like, hey, I want to help. Tell me if you want help. And they may say no. And then you just kind of like beat that drum a little bit. Say like, or even offer like, hey, I took another friend to this place and like they seem like they really have these conversations well, or whatever you want, however you want to approach it, but like not a confrontational way.
Right.
I like to think about those sorts of things in the like I'm not a person with a substance use disorder, but like I have a problem with using my phone too much and using social media too much. And I've had to have conversations about like, like with my wife, like, hey, I like, this is a time that like, I need you to really like not use your phone. It's like, okay, if that was presented in like a super confrontational way, like, hey, you're a dick and you're ignoring me or whatever, like I'm not going to respond to that well. But just approaching it from like, hey, this is a thing that I think is an issue right now. And we can talk about it more later if you want. But like, I would like to see this happen this way because of, and frame it in the context of like, this is how I feel about it. Not about them, not about like, hey, I feel like your life is out of control, but like, I feel like I've seen this happen to you and I want to help. Can you allow me to have a conversation with you about that?
So not blast Semi-Charmed Life and then be like, hey, speaking of drugs, for those of you who don't realize it yet, Semi-Charmed Life is about doing crystal meth.
Yeah.
You go back and listen to that song, you're like, holy shit. I listened to this when I was younger and I was just like singing along with the lyrics, but now, god damn, what is this? Was this lyrics always like this? Yeah. Everybody after this episode is going to go listen to Semi-Charmed Life.
They're going to be a huge spike in listeners.
I know Spotify's
gets a bunch of listeners.
Well, is there anything else you want to touch on that we didn't mention or anything that you want to get across to people?
If you're interested in this kind of discussion, I host a podcast with friend and colleague Macaulay Sexton called Recovery Reform, and basically is all about reframing the way we talk about recovery and talking about it in a non-abstinent, non-sort of stigmatizing way, and wanting to support people where they are in their journey in recovery. So plug that. I'm on.
Where else can people find you? Do all the pluggables.
All the plugs.
I'm on. I don't use Twitter anymore. I'm on X. Or not on X. I'm off of X. I'm not on Twitter. I'm on X.
Musk is happy that you called it X.
I'm on Blue Sky, and my profile is tnicholsmd.com. I don't know. That's pretty much it. I stopped using social media in general.
I get it. I
Oh, yeah.
understand.
Yeah, it's not great right now. Anyways.
Yeah. Well, don't worry. The next 4 years will be a lot better. It's fine.
Yeah. Oh, thank you guys. I appreciate you. Thank you for having me. And I look forward to more of these conversations.
And I look forward to us organizing our MLM.
MLM. I want pyramid scheme. I want to have a pyramid scheme.
Pyramid scheme for good.
Hey, wasn't that a great time listening to the podcast? You were just, I'm assuming you were just listening to in moderation. So if you go ahead and hit the 5-star button, is that a thing? The like button?
That's a thing.
No.
Yep.
The like button
5
on
stars.
YouTube. If you're on YouTube, hit the like button. Not the dislike button. That's a bad button. The
Bad
like
button.
button. Bad
Don't
button.
touch.
Hit
No
all, so hit
touching.
all the other buttons. The share. You can go check out
all those things.
Subscribe. Go check out our Patreon. We do have a Patreon. It's free to join if you want, or you could give us some money. That'd be really cool, like $1 or $2. It doesn't matter. Whatever you have.
That's where you'll find all the news for this.
We're super appreciative. You can find all sorts of other stuff there. We do giveaways, I think, sometimes,
Sometimes.
all that good stuff. Yeah, absolutely. So, peace.